My name is Noel Williams. I'm a general GI surgeon. I practice at the Hospital of the University of Pennsylvania and also at Chester County Hospital. I'm head of the bariatric surgery program for the health system, incorporating mainly the three city hospitals. That would be Pennsylvania Hospital, Presbyterian, and the University of Pennsylvania Hospital. We see a lot of patients from the Chester County area. So now we see patients pre-op out here, operate out here, and post-op care. And the patients come from, a kind of a 10-mile radius or maybe more from here, so it's much more convenient for the patients. Bariatric surgery can be very challenging. The patient populations are quite sick, so not inherently sick, but they have a lot of comorbidities or complicating factors associated with obesity. So heart disease, they have sleep apnea, they have orthopedic issues, diabetes, so a lot of medical issues. So we really have to make sure our patients are very tuned up, in other words, cleared for surgery so that it can be safe. So, it's not just a regular patient coming in to have a hernia repair. This is a patient having a meaningful operation, but also the patient population is relatively high risk. And what we've seen here, like at our own institution, is that the care of those patients, both in the operating room and the post-operative setting, has been excellent. In relation to what technology or innovations happened over the last, I would say 10, 15, maybe 20 years, in especially of GI surgery, bariatric or weight loss surgery, it's been monumental in the care of this patient population. So first starting with laparoscopic surgery, going from open surgery into laparoscopic surgery, and more recently we started doing robotic surgery, which is a kind of a fancy way of doing laparoscopic surgery using a robot. That started in the mid-2000s. So over the last 15 years, the evolution of laparoscopic work and also robotic work has really taken patient care, especially in this patient population, and especially that I'm into another level. The most rewarding part of my work in operating on patients with morbid obesity is helping them. So these patients come to see us, they have a lot of comorbidities, a lot of medical conditions associated with that. They don't mobilize well. And when patients have surgery like this and lose a significant amount of weight, it's a game changer, it's a life changer. And clearly, they're extremely happy with the result. That's pretty satisfying to see that.